everyone, my name is Marilena, and today I'll be talking about eating disorders, which is one of the topics covered in Chapter 21 Addictive and Unhealthy Behaviors. I chose this topic because I hope to become a pediatric nurse in the future, and eating disorders often begin during childhood or adolescence. As healthcare professionals and coaches, we all play an important role in recognizing the signs early and helping young people get the support they need. Today, I'll explain what eating disorders are, the different types, what causes them, their warning signs, how they affect both the mind and the body, and finally, what coaches can do to help. Let's get started. What are eating disorders? So, what exactly is an eating disorder? Eating disorders are serious mental health conditions that affect a person's relationship with food, their body image, and the way they think about themselves. They're much more than simply wanting to lose weight or trying a new diet. Many people who struggle with eating disorders also deal with anxiety, depression, low self esteem, or a need to feel in comfort. Because of this, food often becomes a way of coping with emotional stress rather than something that simply provides nutrition. One thing that's important to remember is that eating disorders can affect anyone. They don't discriminate based on age, gender, body size, or athletic ability. Common eating disorders. So there are three eating disorders that are most commonly recognized. The first is anorexia nervosa. Someone with anorexia severely limits how much they eat because they have an intense fear of gaining weight. Even when they're underweight, they may still believe they need to lose more weight. The second is bulimia nervosa. This involves eating large amounts of food in a short period of time, followed by behaviors like vomiting, excessive exercise, or using laxatives to try to prevent weight gain. The third is binge eating disorder. People with this disorder experience episodes where they eat usually large amounts of food while feeling like they have no control over stopping. Unlike bulimia nervosa, they usually don't purge afterwards. Although these disorders are different, they all have one thing in common. They're serious illness that need professional treatment. Cause and risk factors. So, why do eating disorders happen? The truth is that there's no single cause. Usually, it's a combination of several different factors working all together. Some people may have a genetic predisposition, while others may struggle because of brain chemistry, perfectionism, trauma, stress, family pressure, or even social media. Athletes can also experience additional pressure if they're involved in sports that emphasize body weight or appearance. As coaches, understanding these risk factors is important because it reminds us that eating disorders aren't caused by a lack of willpower, they're complex mental health conditions. Warning signs. Because coaches spend so much time with their athletes, they're often one of the first people who notice when something isn't right. Some warning signs include sudden weight changes, skipping meals, constantly talking about calories, exercising far more than necessary, avoiding team meals, withdrawing from friends, or becoming overly focused on body image. You might also notice mood changes like increased anxiety, sadness, or irritability. Psychological and physical effects. Eating disorders don't just affect someone's eating habits, they affect the entire person. Emotionally, they can lead to depression, anxiety, low self confidence, isolation, and an unhealthy obsession with weight or appearance. These challenges can make it difficult to focus in school, enjoy sports, or maintain healthy relationships. Now, physical effects. Physically, the body begins to suffer as well. People may experience fatigue, dizziness, dehydration, digestive problems, weakened bones, heart complications, hormonal changes, etc. Over time, these health problems can become very serious, which is why getting treatment as early as possible is important. Treatment and recovery. The good news is that eating disorders are treatable and recovery is absolutely possible. Recovery usually involves a team approach. This can include doctors, nurses, therapists, dietitians, family members, and other support systems working together. Therapy helps people understand the thoughts and emotions behind the disorder. Dietitians help rebuild healthy eating habits, while medical professionals monitor physical health and treat any complications. How coaches can help, and my conclusion. I like to end by talking about the role coaches play. A coach doesn't have to diagnose an eating disorder, but they can make a huge difference by creating a supportive environment. Instead of focusing on an athlete's weight or appearance, coaches should praise effort, teamwork, improvement, and healthy habits. If they notice warning signs, they should privately express concern and encourage the athlete to speak with a parent, healthcare provider, or counselor. Sometimes simply letting someone know that you care can be the first step towards getting them the help they need. To wrap up, eating disorders are serious mental health conditions that affect both physical and emotional health. The earlier they're recognized, the better the chances for recovery. I hope to educate families, support young patients, and encourage healthy relationships with food and body image. I also hope I also hope today's presentation has shown just how important coaches can be in recognizing these disorders early and helping athletes receive the care that they deserve. Thank you all for listening.